Before starting the procedure, wear your mask properly. Wash your hands for at least 20 seconds, observing the correct technique. Rub palm to palm and then with your fingers interlaced. Then rub your palm over the back of your hand with your fingers interlaced. Interlock your fingers into your palms. Do rotational rubbing of the thumb clasped into the palm. Do rotational rubbing of clasped fingers into the palm. And then rinse your hands well. Make sure that you have completely dried your hands with a clean towel or tissue. At this point, you can already prepare your materials for your procedure. First, prepare a face mask for your patient, hospital-grade disinfectant wipes, as well as your peritoneal dialysis fluid. You will be expected to check for your PD fluid for 5 things. First would be the strength and the name of your fluid, which will be dependent on the doctor's prescription. Next, check for clarity. Look at the printing through the clear side of the bag. Observe for any cloudiness or discoloration. Also, check the amount of the fluid if it's in the correct quantity. Usually, it would be displayed in milliliters. Try to check for any leaks. Squeeze the bag and check whether any liquid oozes out. Also observe for any broken seals. Finally, try to check for the expiry dates. Other consumables that you will need for the procedure would include your drain bag, your cassette, and your connection shield. Don't forget to check for the expiry dates of the following consumables and for any damages in the packaging or supply. You can now clean the fluids and your supplies with your disinfectant wipes. After cleaning the supplies, you can now proceed to clean the APD machine with disinfectant wipes. However, you must remember to avoid the heater when wiping the machine. You can also include the surrounding work area during the disinfection. After the disinfectant has dried up, you can now turn on the machine. The power switch is located at the back panel of the machine towards your right. Wait for the message prompt to appear on the screen, and this may take approximately 15 seconds. Once the message has appeared on the screen, the machine is ready for use. Wash your hands again properly for at least 20 seconds. You can now proceed to open the PD fluid bags. Place one of the bags on top of the heater line. In case your treatment requires more than one PD fluid, put the extra fluids on the sides of the table. You may now proceed to open the drain bag. The package usually includes 2 drain bags, but in this instance, we will only be using one. Take the bag and place it on top of the fluid on the machine. We can now proceed to open the cassette. Try to peel the package from the side carefully. Remove the blue sticker. Place the lines on your forearm and hold the cassette with your right hand. You can now press the green button. The machine will then display load set. Feel for the vibration on top of the door. After the vibration is over, push the lever up to open the door and put the cassette in. Close the door, pushing the lever down. Put the organizer in front of the door using the guides. One will be on top of the door and the other in the middle. Proceed to close all the clamps. There are a total of 8 clamps to be closed. 6 white clamps, 1 red clamp, and 1 blue clamp. After ensuring that everything is complete, press the green button again. This will prompt the machine to display self-testing. Proceed to wash your hands again for at least 20 seconds. After the machine finishes its self-testing, it will prompt you to connect the bags and open the clamps. Connect the drain line to the drain bag. Make sure to use a septic non-touch technique when connecting the bags. Remove the covers and spike the drain bag through the drain line. Place an incontinence sheet or newspaper under the table. Make sure that the clear side of the drain bag is facing upward. Finally, place the drain bag under the table. Next, take the heater line, the one with the red clamp, and connect it on the fluid on top of the machine. Again, maintain a septic non-touch technique when connecting the 2 lines. Break the safety seal and screw the line on the bag. Make sure that it is tightly connected. Break the green seal by using back and forth motion and open the red clamp. You can also connect the supply lines or the one with the white clamps for additional fluids if it is prescribed. If in case the dialysis prescription requires a last fill, then you can utilize the line with the blue clamp. Next, proceed to open the patient line, which is located at the leftmost corner of the organizer. At this point, make a final check and make sure that all the clamps for the used lines are open. Then, press the green button. The machine will then proceed to priming. At this point, while waiting for the machine to finish priming, you can opt to clean the PD catheter exit side and change the dressing. After finishing the priming, the machine will display Connect Yourself or Check the Patient Line. Open the connection shield and remove the gauze from the catheter. You can then wash your hands again for at least 20 seconds. Connect the patient line to the PD catheter. Again, use a septic non-touch technique while doing this procedure. Remove the protective caps from the lines and screw the line to the PD catheter securely. Then cover it with a connection shield. Twist in order to open the transfer set. Then, secure the lines on the patient's bed. Again, press the green button to start the treatment process. The machine will then display initial drain.
During each drain phase, use dialysis solution or the effluent containing waste products and excess fluids is drained from the peritoneal cavity.